occupational therapy students. My name is Stephanie Shane, the founder of PASA OT, and in today's Facebook question breakdown or YouTube breakdown, I'm going to show you how to get a question right from spinal cord injury. So before we get started, remember to believe in yourself and all that you are. Know that there is something inside you that is greater than any obstacle. So let's get started. We're going to ask you to simply fill in the blanks or write it down on your whiteboard and remember the mnemonic. Read with diligence and patience before answering. So first, we're going to read the question carefully. A 32-year-old woman was recently involved in a motor vehicle accident and subsequently sustained a complete spinal cord injury at the level of C6. The patient is the mother of 2 children, one of which is 3 months old and whom she is exclusively breastfeeding. As a result of her injury, her milk ejection reflex is absent, affecting her milk production, and her ability to handle her infant is impaired due to poor hand function. With the help of medication and visualization, the patient has been able to produce some milk. What should the CODA recommend for the patient to do in order to maximize her independence in feeding her child? So in step 2, we want to realize where are we at in the OT process. We are in the intervention stages. Step 3, what is the disease or diagnosis? It is a C6 spinal cord injury and it's not progressive, but functional improvements are unlikely. And in step 4, we want to know what is the patient's problem. It is that she has been exclusively breastfeeding her 3-month-old baby since injury, poor milk production, and difficulty handling baby due to limited hand function. In step 5, we want to know what is the question specifically asking. Well, it's asking what can the CODA recommend to help the patient breastfeed her baby. Milk production has been addressed and is improving with intervention, and we need to structure how the baby is being breastfed to optimize independence for her mother. So now let's get into the answer choices. A, create an adapted handle on the bottle filled with baby formula. B, place the child in a frontal sling carrier which has an opening to support the baby's head and allow for the baby to latch onto the mother's breast. C, use nursing pillows and wedges to support the mother's arm during breastfeeding. D, lay supine in bed while the baby is held and prone to allow latching onto the mother's breast. Well, we know that A is incorrect because the patient has chosen to breastfeed instead of using a bottle. B is incorrect because the possible movements at C6 include forearm supination and elbow flexion. Therefore, a sling is not necessary. D is incorrect because holding the baby prone while the mother is in supine would cause fatigue in her shoulders. Therefore, it is not an optimal position for her to breastfeed. Therefore, C is the correct answer. Use a nursing pillow and wedges to support the mother's arms during breastfeeding. A functional letdown reflex is required to provide adequate milk to a nursing infant. Infant suckling activates tactile receptors in the breast, and this signal is carried via affected nerves in the T4-6 dorsal roots in the spinal cord, and then in neurons in the hypothalamus, which release oxytocin into the bloodstream. Oxytocin triggers milk ejection from the breast. Suckling-induced efferent stimuli are absent in women with spinal cord injury above T4. Fatigue is common for patients with spinal cord injuries, and supporting her arms is therefore essential to reduce fatigue. I wanted to remind you that PASA OT is not just a study prep for the MBCOT exam. Our staff is dedicated to bettering the lives of OT and OTA students and their families. We approach this goal with dedicated personnel, best-in-class study materials, cutting-edge technology, and strategic partnerships to help our students build their confidence, overcome obstacles that seemed insurmountable, and obtain their dream career. Please visit us at pasaot.com and send us a chat message. We are available 7 days a week to answer your questions. Good luck with all your studying, and we are here if you need us. Bye.